All right, and the injury report is brought to you by Rothman Orthopedics. To learn more about their New York locations, go to rothmanny.com. We now welcome in Dr. Brandon Erickson, a sports medicine surgeon at Rothman Orthopedics, New York, and he joins us now, going to join us each and every week as we institute a new segment here on Football Sunday. Good morning, Doc. It's Mark Malusis and David Deal, and we appreciate the time this morning.
Yeah, really happy to be here. Thanks for having me on the show.
Yeah, you got it, Doc. First and foremost, I mean, when you think about injuries, let's start Jets and Niners today. The Kittle injury for the 49ers. He's a huge fantasy player. We know that. Earlier reports during the week was that he was going to miss practice all week long. Looked like it was a scary knee injury a week ago against Arizona, but that he was going to indeed try and play this afternoon. He was ruled out on Friday. What about that Kittle injury for the 49ers?
Yeah, it's interesting. You know, it's an injury that he kind of played with last year. He kind of sprained that knee last year. And when you see him go off the field this year, it was pretty concerning. But then he came back and played on it. He wasn't super effective in the second half, but he was able to play on it. You know, there's a lot of things that can get injured when they give you a quote-unquote knee sprain type injury. There's obviously the ligaments around the knee, as you know. There's a lot of muscles and tendons that cross the knee. And then there's the capsule of the knee, which is almost like a water balloon that goes around the knee. And any one of those can get injured. And when you get a diagnosis of a knee sprain, the hope is that it's either a very mild ligament injury, like a grade 1 MCL injury, which is that ligament on the inside of your knee, or that it's just a sprain to the capsule or a little bit of inflammation. So we'll see how he trends this week. I'm hopeful that this won't be a long-term injury for him, and fantasy players who drafted him in the second or third round won't be out there tight end, but this is going to be more of a week-to-week decision.
You know, and for the Giants versus the Bears, obviously Golden Tate was limited with his hamstring. He's questionable for this game. And same thing, there was limited practices for Khalil Mack with the knee, and he's questionable for today's game. Just talk about that matchup. And one other thing I would love for you to talk about, Doc, is a lot of people have seen throughout week 1 and week 2 of the NFL season the ramp-up of hamstring injuries. Obviously, no preseason time. It takes some time to build up the callus. I would love for you just to explain very concisely and briefly the different amount of grades that you can get on a hamstring.
Yeah, you really hit the nail right on the head there with the hamstring injuries these first couple weeks. You've seen it creep up on a ton of the teams' injury reports. Hamstring injuries are coming. We saw a similar thing in Major League Baseball because of the shortened preseason, and I think we're seeing a lot of that now in the NFL with the shortened off-season and not having any preseason games because of everything that's going on. You know, as you know, obviously from playing, you know, it takes some time to get into game shape, you know, and it's really hard to emulate what the game is like in practice. And so when you have guys quick cutting and pivoting on the hamstring, it's not an uncommon thing when their bodies aren't conditioned and ready to go to sustain a hamstring injury. Dehydration can lead to it and things like that, but usually it's not the body not being conditioned and ready for the games. So as far as hamstring injuries go, you're exactly right. There's different grades. So there's grade 1, there's grade 2, and there's grade 3. The usual one that we see in football players is a grade 1 injury where there's no tearing of any of the hamstring muscle or tendon, but that there's just some edema or swelling around the hamstring. This is why we oftentimes get MRIs on guys who, you know, tweak their hamstring, tweak their quad, because we want to see what grade it is because it helps us predict how long they're going to be out. If they have just a grade 1 injury where they didn't tear any of the muscle, they didn't tear any of the tendon, you're looking at usually, you know, a week or so that you're going to miss, maybe 2. As you start to get a little higher up into the grade 2 strains, this is more where you tear some of that muscle, but usually less than 50% of it. And this one's going to keep you out a little bit longer, usually in the average of 2 to 3 games when you have a grade 2 injury. And as you get into the grade 3 injuries, which is kind of a complete tear, then you're talking about potentially surgical intervention if they need something like that, depending on where the injury is, how bad the tear is. And this is looking more like a 6 to 7 game stretch that they're going to miss. So generally we see them on the grade 1 injury strain, and that's kind of what we're looking at most of the guys. But they definitely vary, and you really classify them based on an MRI.
You know, Dr. Erickson, I asked you about Kittle, and David asked you about the hamstring injury, and we've seen a rash of them. Whether, you know, Jamison Crowder for the Jets, another guy that went down with a hamstring injury. Mims, their talented rookie wide receiver, obviously has been dealing with a couple of hamstring injuries through camp and early on this season. I'm curious about ankle injuries, and I bring that up because of Saints stud wideout Michael Thomas. He's going to miss his first game in 4 years tomorrow night as the Saints are on the road in Vegas taking on the Raiders, dealing with a high ankle sprain. How about high ankle sprains? I know it's something that we all talk about. We've heard about it regardless of sport, more so in football than anything else. But what about what that Saints receiver is going through? And realistically, when could you expect him on the field?
Yeah, I mean, as most Giant fans know the high ankle sprain from, having Saquon have an injury like that last year, and then, people like Christian Kirk and Kamara dealing with high ankle sprains. Those are tough injuries. The ankle sprains that we usually get, your garden variety ones, are usually when you roll your ankle, you tear some of the ligaments in the ankle, and usually you get some swelling. You go into a boot, you get the swelling at your back in a week or two. As you start to get these higher grade, these high ankle sprains, what happens is as you sprain that ankle, there's a force that goes up your leg and comes out the top of your leg. So now you disrupt something called the syndesmosis, which is basically this tissue that holds the two bones of your leg together. So it makes the ankle a little less stable. It makes the leg a little less stable. It makes it much harder to run on. And so when you have a guy like Michael Thomas, who, even though he seems to be fighting through this injury in practice this week, they're holding him out. I would not be surprised if he missed a couple of weeks if this really was a high ankle sprain. This can really be something that's pretty irritating to deal with and can be difficult to come back from.
And in regards to concussions, we know that it all depends on how severe the concussion is and the impact, and then the post-screening to see when the return-to-play protocol happens. What do you see that really the NFL has honed in on, especially in a year like this with no preseason and no off-season? What do you think the precautions are going to be when it comes to concussions, especially on a season like this one?
Yeah, that's a good question. When you played back in the day, when I had my limited amount of playing back in the day, we usually took a preseason screening test. We did this impact screening on the computer beforehand, and again, it gave you a baseline number where we saw how fast you were processing things mentally to see if you had a concussion. Then, if you got back to that baseline level, you could retake that test. We've gone away from that a little bit because there were some guys that would kind of game the test from time to time. They would maybe be a little slower when they were taking the test so that if they had a concussion, it wouldn't look like they were slower. So it's kind of gone away from that. We used some other tests, some screening tests on the sideline that deal with memory recall, some muscle strength, neck strength, things like that, and, of course, loss of consciousness. And so you go through this, basically progression, and you have to go through certain phases of the progression before you can come back. And it's really hard to skip any of the phases or put you through them too fast because the main goal is to keep guys safe, as you know, now that we're learning more and more about concussions. And so in a shortened season like this, I don't think it changes anything from a keeping guys out perspective from a concussion. I just think they have to still go through that concussion protocol, and it's hard to do. Like, for example, for Godwin, when he gets put into the protocol a little later in the week because maybe it wasn't picked up on as quickly when he had the injury, during the game, and so you start that protocol a little bit later, which is probably one of the reasons he's out today.
We're chatting with Dr. Brandon Erickson from Rothman Orthopedics, Mark Malusis, David Deal, Football Sunday, Week 2. Doc, I want to ask you about Sprained AC Joint. Bring that up because of Cortland Sutton from the Denver Broncos. Couldn't play Week 1, expected to play this week. Led them in receiving a year ago. Has got a good chemistry with their second-year quarterback out there in Denver. They're on the road in Pittsburgh today. What about dealing with sprained AC joints, particularly when you're looking at a wide receiver?
Yeah, so this is something that we see a lot, especially in running backs. When you come down, you get tackled onto your shoulder, you get an injury to the AC joint, which is basically the joint that connects your collarbone to your shoulder. And so these come in a ton of varieties as well, kind of similar to hamstring injuries. We classify them kind of as grade 1 to 6, and the injury classification is kind of based on how much displacement or how far apart the two bones are. If you run your hand along your collarbone and to the side there, you feel that bump. That's your AC joint. Some people have really prominent bumps. Some people have really kind of very minimal bumps, and everybody's made a little bit differently. But when you have an AC sprain, kind of like Cortland Sutton did and Josh Jacobs did last year, if you have a minor injury where you just injure some of the ligaments or the joint capsule in that joint, usually that's a week or two that you're going to be out. Sometimes we talk about, do they need an injection to get back? Because it's really just managing pain. It's not really a loss of function injury. It's more of a painful injury. When you start to go a little bit further along the injury spectrum of grade 2, grade 3, and et cetera, that's when we talk about being out a few more weeks because there can be some loss of function in those, and occasionally we have to fix those surgically. So for Sutton, I think it's more of a pain issue for him. I think there is a possibility he'll go today. I think he's probably more likely than not to go today. But if he winds up going up and landing on that shoulder, he always runs the risk of re-injuring it, re-aggravating it.
And then also, we've had a lot of foot sprains. Quan Short, the D tackle for the Carolina Panthers, is out today. Alshon Jeffrey, the wide receiver for the Eagles, is out today with a sprained foot. What are the precautions that they can take, and how fast is the time to heal and get back on the field from that?
Yeah, that's kind of a big catch-all diagnosis because, you get Philip Lindsay all dealing with this, questionable turf toe injury that he's out today. It's a kind of a sprained foot can be a lot of things. You can injure the kind of soft tissue on the bottom of your foot, your plantar fascia, and that can cost you a couple of weeks. You can have a little bit of arthritis in some of the joints of your foot and just kind of irritate that because of cutting and pivoting, or you can get a turf toe injury like we've seen in some tight ends in the past and like we've seen in Philip Lindsay now. The foot injury is a little bit difficult to kind of throw into one catch-all, but a lot of times if you wind up with just spraining some of the ligaments of the foot, that's a week or two that potentially is going to cost you. And sometimes, obviously, we can tape things up and use different braces to help, guys go along. Use sometimes these carbon fiber inserts into the shoes that are kind of stiff-soled so that the foot doesn't move as much, although it makes it a little harder to run in. So it's kind of a trade-off there.
Doc, last one for me is going to be how a player looked. Want to get your perspective because I thought Roethlisberger Monday night he's home today entertaining Locke and the Denver Broncos. Roethlisberger last Monday night took about a quarter and a half to knock off the rust. There was also times in the game, and I understand he took some hits where you saw him shaking his right arm, kind of gripping his hand as well, coming off what was a pretty significant elbow injury that he suffered last year. When you were watching Big Ben throw the football last Monday night, how do you think he looked first game back off of that elbow injury and surgery?
Yes, it was really interesting to see how he would come back because we don't usually see this type of injury in professional quarterbacks when you wind up tearing some of the tendons and muscles around your elbow and having to have them basically surgically repaired. He was wearing that sleeve that you kind of saw him on the sideline every time they came out in between series when he had that kind of black sleeve or kind of black jacket on his arm to keep his elbow warm, almost like you see a pitcher do sometimes in baseball. It's sometimes difficult to come back from that type of injury, especially because the amount of stress he puts on his elbow. But what I will say is that quarterbacks put a lot less stress on their elbow than, let's say, a baseball pitcher. Now, baseball pitchers generate a tremendous amount of stress when they throw. Quarterbacks do as well, but it's a different shape of a ball, different mechanics. So they actually can do relatively well after injuries like this. It's just not a common thing to see. So I agree with you. The first quarter or so, he didn't look, super comfortable, but I think once he, knocked the rust off, he started to look a lot better and was getting the ball downfield without a problem. I don't think this is going to be a long-term problem for him this season. Once you recover from an injury like that and your arm feels good, sure, it does put you at increased risk of having a future injury down the road, but presumably he's been rehabbed pretty well, and I don't see this as being a problem for him long-term this season.
Dr. Brandon Erickson, check him out, Rothman Orthopedics. He's going to be joining David and myself each and every week the rest of the way during the football season. Doctor, thank you. Enjoy the games today, and we appreciate your expertise this morning.
Yeah, I appreciate you guys having me. Have a great day.
Thanks, Doc.
You got to learn more about their New York locations. Go to RothmanNY.com.